There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what symptoms does one have of high blood pressure? Answer by Melati Dwyania Grigalik. As we all know, blood pressure is considered high when the systolic BP is greater than 130 millimeters. Hg and diastolic BP greater than 90 millimeters. Hg. The symptoms you ask? It really is subjective. For some people who are used to having their blood pressure high, they won't even feel anything. But to some people who are used to having their blood pressure low or normal, they could experience headache, dizziness, palpitation of the heart, and in some severe cases, it can lead to hemorrhagic stroke and cardiac failure. Your blood pressure is high due to the compensation mechanism, the vasoconstriction, the constriction of the blood vessels. Constriction of blood vessel could occur because of atherosclerosis, when the inner wall of your blood vessel is damaged by the accumulation of fat and cholesterol, stress, etc., which is why high blood pressure occurs more in obese and or elderly patients. When the blood vessel constrict, the blood flow to organs will decrease. Some organs like brain and kidney are more sensitive to lack of blood flow than others. Like brain, is so sensitive to hypoxic condition because brain cells metabolism mainly depends on the presence of oxygen, which are transported by red blood cell. Therefore our body will do what it can to make sure that these organs get sufficient supply of oxygen. How do they do that? By increasing the pressure so sufficient amount of blood per seconds or per minute could reach the aforementioned organs just fine. And if the blood transport is still insufficient, the organs could experience hypoxia. In brain it could manifest as headache, in kidney it could manifest as pain on the flank ratio. But what about the heart? How do heart somehow relates to high blood pressure mechanism? The heart will have to pump harder and or faster to make sure the pressure of blood is increasing. If this keep happening, or in chronic condition, this could lead to the hypertrophy of heart muscle, like when you lift weight daily and your biceps get larger. This is why some people with chronic high blood pressure also have cardiomegaly condition, or left ventricle hypertrophy, LVH, condition. When it's just the hypertrophy, then it means that the body can still compensate it, but at some point the heart will be tired because the body can't supply enough energy for the so increasing muscle cells, and stop functioning totally, which lead to cardiac failure. And for the hemorrhagic stroke, it can happen when the blood vessel in the brain is ruptured due to the increasing of blood pressure, which tear apart the wall of the vessels, leak the blood to the intravascular space and leave the brain ischemic and irritated. This is why doctors or nurses check your blood pressure regularly, because some symptoms are hidden really well while your body can still compensate it. And if you during the BP check your BP is high, then you will be advised to do exercise. Control your diet, and if necessary, take some high blood pressure medication to control your BP and prevent complications. Hope this helps. I would love it if you find error here and help me correct it. I am still a medical student, not yet a doctor. Good luck and stay healthy. Answer by MR Swan. Stress can be the most important reason. Yes, stress. A link between stress and high blood pressure is still on its way, and researchers are doing work on it. Stress is famous to add to risk aspects similar to a poor diet and too much alcohol intake. Here's you can find how to reduce stress in order to lower the blood pressure level and the relationship between stress and high blood pressure. Answer by Robert Wolverton. Hypertension worthy of medical attention usually causes no specific symptoms until damage and complications occur: kidney failure, stroke, peripheral vascular disease, and so on. While many people believe that headache is a result of elevated blood pressure, I suspect the relationship is the reverse, if there is causation at all, unless the blood pressure is extremely high, 240/120, for example.